Transmite en su canal de frecuencia modulada estereofónica multiplex La Voz Radio, desde New Haven, Connecticut, al mundo.
Buenas tardes, good afternoon. My name is Caprice Taylor Méndez. Es un placer estar aquí con ustedes de nuevo con Juntos Podemos, here with Together We Can, where we celebrate co-creators of a kinder and more just world. Aquí es un gran placer estar con ustedes en 103.5 FM detrás de la voz hispana de Connecticut, en vivo desde New Haven, donde celebramos co-creadores de personas para crear un mundo más justo y más gentil. Y estamos aquí hablando directamente desde New Haven, aquí celebrando todavía, yo diría que debe de ser un mes de equidad de salud en Connecticut. El tema de hoy va a ser eso. Y fuimos a una conferencia la semana pasada, fuimos invitados para estar presente y también poder hablar con el público directamente en Connecticut de los desafíos que todavía hay que enfrentar para poder tener equidad en salud para todas las razas y sin depender en qué código postal donde uno vive, sin tener que depender en tener acceso a beneficios de salud, que tenemos muchos desafíos que enfrentar aquí en Connecticut, y el contralor del seguro médico de Connecticut invitó a un gran grupo de líderes que están haciendo todo tipo de esfuerzos para mejorar la salud de los residentes de Connecticut. Y con eso tenemos hoy las grabaciones en vivo de la semana pasada, el 3 de abril, y vamos a empezar con el Contralor Sean Scanlon del Seguro Médico del Estado de Connecticut. And so thank you for those who are listening. As you have noticed, this show is bilingual as always. Here in Together We Can, Juntos Podemos, we celebrate co-creators of a kinder and more just world. And I have with you some snippets of a very important press conference that took place last week on Monday for Health Equity Week. It was the first inaugural recognition of Health Equity Week that was passed into state law. So every first full week of April will be Health Equity Week, where we get to uplift all of the challenges that we have yet to face to assure that despite zip code and race, ethnicity, every resident in Connecticut has an opportunity for optimal health here in Connecticut. And without further ado, we'll hear directly from the hosts that gathered leaders that are focused on addressing and bringing forth policies and practices that can strengthen the health of residents in Connecticut. And so without further ado, we'll share with you some videos from the press conference on April 3rd. Por favor, William, podemos empezar con el Contralor Scanlon.
What that report showed, it was of our state employee plan, which is, the comptroller runs the largest health plan in Connecticut. There are over 250,000 people who get insurance through my office in Connecticut every day. And what that health employee plan, health equity study showed was what we all know, right? Which is that Black and Hispanic communities saw higher rates of getting their health care in an emergency room setting versus a primary care doctor. We had people who didn't have even access to a primary care doctor that were state employees in one of the best health systems and healthcare insurance networks in the state. And so for me, the challenge is what can we do, what can I do as the comptroller, sort of seen as the chief healthcare officer of the state, to actually try to improve this. One of the things that I'm spending the most amount of my time on these days is called the Primary Care Initiative, where we are actually paying doctors to see more patients for primary care, incentivizing them to do it, incentivizing the patient to go and get seen by a primary care doctor, so that way they can catch things that are comorbidities. They can address them on the early side of things and make sure that we're trying to make sure that everything we do is looking at the lens of how can we improve overall healthcare in Connecticut, but making sure that we're not just ignoring what we all know are the inequities that are out there, even in a plan like the state employee plan here in Connecticut. So want to bring up some great speakers who can talk a little bit more about this.
Lo que vamos a hacer es traducir después de cada persona que está hablando. We're going to translate after every individual that speaks, and just want to uplift Controller Scanlon's mention of preventive dollars goes a long way. It saves everyone money, and from the state with Controller Scanlon's office, looking as to how to save us all money by investing in assuring that residents in Connecticut have access to primary care doctors. El Contralor Scanlon dice de que él está encargado de manejar el seguro médico más grande del estado de Connecticut, y eso es con Access Health CT. Y de allí hicieron investigaciones, anotaron de que lamentablemente la mayoría de las personas que faltan tener un doctor primario son las personas negras y latinas aquí en Connecticut, que lamentablemente muchos de nosotros vamos a hospital de emergencia en lugar de poder obtener tratamiento de prevención, tratamiento con un doctor primario. Y él lanzó una iniciativa detrás del departamento que está encargado de los seguros aquí en Connecticut, para pagar directamente a doctores a que vean sus pacientes con más frecuencia en situación de visitas al doctor primario, para poder disminuir los gastos en utilizar los cuartos de emergencia en los hospitales, porque eso nos cuesta mucho más dinero a todos. Si esa es la única manera que nuestra gente puede acceder a asistencia médica. Entonces, él quiere tratar de ver cómo apoyar a que los doctores aquí en Connecticut vean con más frecuencia a nuestra comunidad latina y negra. Y de esa manera también poder detectar en una fase temprana cualquier problemas de salud que uno tenga. Y también quisiera levantar en este momento el esfuerzo de Husky for Immigrants, que es una coalición de nuestra gente a nivel estatal, que en este momento todavía está empujando legislación en la Casa Estatal para poder proveer a las personas, sin importar el estatus inmigratorio, acceso a seguro médico en este estado de Connecticut, detrás de el seguro del estado. Y en este momento se está discutiendo si va a proveer el estado. Se está viendo a la edad de 18 para abajo a las personas, sin importar el estatus inmigratorio. Entonces, para los quienes están escuchando, ahora es el momento también para levantar la voz y dejar saber a su representante político lo que usted piensa, si es algo que se debe de hacer, si es algo justo, algo humano, para apoyar, porque ahora es el momento que deben de escuchar la opinión de uno, porque como dice el Contralor Scanlon, en la prevención se puede ahorrar dinero para todos. And so I just want to uplift, as you heard Controller Scanlon speak, speaking to the fact that prevention dollars is the best use of funds versus emergency room visits, being able to have a primary care physician. And I just wanted to uplift that at this very week in the state of Connecticut, the Connecticut legislators are weighing whether or not to support all human beings from 18 and under, age 18 and below, to have access to health insurance, which opens up the doors to have a primary care physician and utilizing preventive dollars for healthcare versus the costly point in time of healthcare in the emergency room that currently thousands of undocumented or immigrants with various legal status are accessing due to the lack of access to health insurance in the state of Connecticut. And so Husky for All Immigrants is one of the strongest group promoting and pushing for the legislators to save us all money by allowing, regardless of immigration status, Connecticut residents 18 and under to be able to access health insurance. So I just wanted to point the fact of what is happening at the State House today, this week. Very important. And so without further ado, we'll go to Aisha Clark, the Interim Executive Director of Health Equity Solutions. Y ahora vamos a escuchar directamente de la directora ejecutiva interina, Aisha Clark, de Solución de Salud, de Equidad para la Salud.
And advocate for community health workers. For that reason, HES is focusing our 2020-23 Health Equity Week efforts in uplifting the important work of community health workers. These non-clinical health professionals are key to
Y la señora Aisha Clark acaba de hablar de también en el mes de abril, empezando con la semana de abril, la primera semana de abril, Health Equity Solutions está enfocando sus esfuerzos para mejorar, fortalecer equidad de salud aquí en Connecticut, en apoyar los esfuerzos de las clínicas comunitarias de salud, a otorgarlos a ellos fondos para tener trabajadores de salud comunitarios parte de su equipo, proveyendo asistencia de salud a las comunidades, porque reconoce la importancia de los trabajadores de salud comunitarios que no son doctores, pero sí conocen la cultura, el idioma y la manera en cómo tratar bien a la comunidad, hacerse sentir que pertenecen en las instituciones médicas, que las puertas están abiertas y ahí van a tener a alguien que los conocen bien, que conocen la cultura, que son parte de la comunidad y han visto el gran impacto positivo que estos puestos de trabajo, personas que no son doctores, tienen en poder mejorar la salud de nuestra comunidad. Y en este momento también a nivel estatal se está discutiendo sí o no van a otorgar fondos para tener estos puestos de trabajo tan importantes. Pero para tener esos puestos se requiere fondos y estos fondos, cada centavo, ayuda a fortalecer los esfuerzos de prevención. Entonces, en este momento, la directora ejecutiva interina, Aisha Clark, está enfatizando la importancia de los trabajadores de salud comunitaria para tener igualdad de salud aquí en Connecticut. And so, as we speak once more, At the state level, there are discussions whether or not to provide additional funding for community healthcare workers. And so just again, emphasizing that every dollar, every penny spent in support of community healthcare workers, we are actually strengthening and supporting preventive care, preventive dollars, and people feeling comfortable to walk into various healthcare settings to get the proper care that they need and deserve, and feeling heard and feeling seen as a full human being, regardless of the language that they speak at home or ethnicity or race, because the community healthcare workers have played for decades an important bridge between traditional healthcare settings and the growing diversity of our community here in Connecticut. And without further ado, we'll go to the next speaker. Por favor, William. I'd like to introduce Dr. Linda Berry, Interim Director of the Yukon Health Disparities Institute. Vamos a escuchar directamente de la doctora Linda Berry, que es directora interina del Instituto de Desigualdad de Salud en la Universidad de Connecticut, Yukon.
There's all of the individuals who work to ensure that everyone in our community has access to equitable, affordable, and quality healthcare services. This work is certainly not for the faint at heart and can often be extremely disappointing and tiring, leaving one questioning humanity at times. However, I think I can speak on behalf of all of us on the front lines that we would not have it any other way. So thank you for fighting for equity. At Charter Oak, we believe that everyone deserves access to high-quality health care, and our mission is to promote healthier communities by providing quality, safe, patient-centered healthcare services in medically underserved areas, regardless of an individual's ability to pay. And there are 17 federally qualified health centers in Connecticut who are fighting for that same mission. We recognize that achieving health equity requires a collaborative effort, and we are proud to partner with organizations across Connecticut to address the health disparities that exist in our state, the disparities that have been allowed to last and flourish for far too long. We know that achieving health equity will not be easy. It requires more than lip service, rather a sustained and action-filled effort, a commitment to social justice, and a willingness to work together towards a common goal. Achieving health equity requires courage and ingenuity, and we must be willing to acknowledge that our system needs repair, and we must be willing to make radical commitments of resources necessary to invest in the rebuilding of our healthcare, education, workforce, and criminal justice systems. Yes, achieving health equity requires that we take a hard look at all of these systems. And we can start by overhauling our Medicaid payment system. Just thought I'd put it. Is it hard? Yes. Is it possible? Absolutely. But by working together, we can create a future where everyone in our community has access to the care they need to live a healthy and fulfilling life, regardless of their race, their ethnicity, their sexual orientation, gender identity, and socioeconomic status. So thank you so much for your support and acknowledgement. We look forward to working with you all in the days, weeks, and months ahead to achieve health equity for all. And we look forward to the work that comes with this declaration that racism is a public health crisis. We look forward to putting action behind those words so that it's not just lip service. We look forward to ensuring that everyone has access to equitable health care. Thank you.
Y esas palabras tan lindas and those beautiful words were actually from Nichelle A. Mullins, President and CEO of Charter Oak Health Center Incorporated. La persona que estaba hablando era la presidenta y ejecutiva encargada de la clínica de salud Charter Oak, basada en Hartford, Nichelle Mullins, y acaba de compartir el compromiso que tienen las 17 clínicas que se encuentran a nivel estatal en varias comunidades por Connecticut y asegurando de que nuestras comunidades pueden acceder a cuidado de salud de calidad, de alta calidad y con bajo costo. Y para poder fortalecer equidad de salud aquí en el estado de Connecticut, la señora Michelle Mullins dice de que hay que tener una colaboración y también hay que fijarse uno de que la salud es dependiente de uno en las varias instituciones que impactan la calidad de las vidas de las personas aquí en el estado de Connecticut, no solamente vigilando y trabajando para mejorar los servicios de cuidado de salud, pero también de las instituciones como la educación pública y también cómo nos impacta el sistema justicia aquí en este país. Y podemos empezar también a nivel estatal, están discutiendo si van a cambiar o no la manera que pagan de vuelta por los servicios proveídos por las clínicas comunitarias de salud aquí en Connecticut, porque están en un momento de crisis en la manera que reembolsan los pagos de Medicaid. Tienen que aumentar el porcentaje de reembolso a las clínicas comunitarias porque no están reembolsando por los servicios proveídos a nivel suficiente para poder sostener de alta calidad y de bajo costo los servicios de salud para las comunidades. Y eso fue también en este año, es parte de lo que están discutiendo en esta semana en la Casa Estatal. And so I just want to also side note that at this time, another legislative discussion around funding is the Medicaid payment rate for the community health centers and the services that they provide. And we are reaching a crisis point if the state does not look at the funding formula for the Medicaid payment plan to the for the services provided by our local community health centers. That is a gem for our communities. And so that is being discussed as we speak as well. And without further ado, we'll go to our next speaker, and Controller Scanlon will introduce them. Al próximo video, por favor, William. Gracias.
White mother is 4%. You know, for a black mother in the state, it's 11%, okay? So the low infant mortality rate that you see across the state is not the only number we need to look at. Even in a state like this that has got a lot of good things done when it comes to healthcare, 25% of Hispanic people in the state don't have a primary care doctor. To me, that's just unacceptable. That's why we're here. So anyway.
So I'll translate now. El Contralor Scanlon dice de que no debemos de pensar de que hemos logrado igualdad de salud cuando vemos, por ejemplo, las estadísticas que dicen no más 4% de las mujeres con niños, bebés recién nacidos parecen con problemas que causa la muerte de los bebés. 4% aquí en el estado han sufrido por la pérdida de un bebé nacido que se ha muerto, y de las mujeres negras 11%, más del 11%, más del doble han tenido que pasar por esa situación terrible. Y uno tiene que ver directamente cómo impacta en diferentes áreas de salud el estatus de salud de cada raza. No se puede decir todos juntos estamos muy bien, pero cuando uno ve raza, por ejemplo, nomás uno en cada cuatro latinos no tiene un doctor de primario, a primary care doctor. Les falta un doctor primario, uno en cada cuatro. Y eso no podemos sentarnos sin saber de que hay mucho más trabajo que hacer. Y con eso vamos al próximo video.
It's nice to see you in my new hat, and yours as well. And thank you, Charter Oak, for hosting us today. It's so good to be with you on the kickoff Health Equity Week, and I also really want to join in that. Hopefully not forever, but for a good long time until we really get things under control and make sure that we have a fair society. My name is Caprice Goodwin. I am the Executive Director of the Commission on Racial Equity and Public Health, which was established following the state's declaration that racism is a public health crisis. We are the nonpartisan legislative shop for policy analysis and recommendation with a racial equity lens. Racism enacted through policy and practice has caused severe health inequities along racial lines. And only anti-racist policy and practice can change that course. Health outcomes are informed by many different factors, including the air we breathe, the housing that we live in, and the healthcare that we can access. We're fortunate to have resources in Connecticut such as Charter Oak, who do make sure that care is accessible regardless of ability to pay. And we know the patients who walk through these doors are more likely to be housing and food insecure, more likely to have lived near polluting facilities, and battling chronic illnesses. The culmination of these factors contributes to adverse health outcomes, with shortened life expectancy being the most extreme. In Hartford County, life expectancy varies by 19 years, depending on which census tract you live in. Black and Latino families disproportionately reside in the tracts with lower life expectancy. The physical and social division of people by race is a driver of health inequity, and we know it is plainly wrong. We are committed to righting these wrongs. Our charge at the Commission is to illuminate the impact of legislation on communities of color and to recommend solutions that will improve the lives of people who have been harmed by racist policy. Every Connecticut resident deserves an equal opportunity to lead a healthy life. Health Equity Week is an important time of year where we face these issues head on, we name them, we name the problems, and we seek the solutions. It's an honor and a privilege to be here today with leaders who believe that health is a human right and that your health should not be dictated by the color of your skin. Thank you for joining today and for recognizing this very important week.
Y gracias a la señora Parisa Charmchi Goodwin, directora ejecutiva de la Comisión de Salud Pública para Igualdad de las Razas. That was Parisa Charmchi Goodwin, Executive Director of the Commission on Racial Equity and Public Health. Ella acaba de discutir sobre la importancia de reconocer que las pólizas racistas del pasado y el presente causa un gran desequilibrio del estatus de salud en nuestra comunidad en Connecticut, y en específico, si uno está anotando los datos de salud en el condado de Hartford, puede notar la gran diferencia entre el acceso en poder acceder cuidado de salud y polución o no en el aire donde uno vive, dependiendo en el código postal, en qué vecindario en donde uno vive. Y lamentablemente el cambio de vecindario dentro del condado de Hartford puede quitarle uno hasta 19 años de vida. La diferencia de un vecindario al otro, dependiendo de donde uno vive, puede cambiar, puede cortarle la vida o aumentarlo por 19 años. Y es importante reconocer que también la instabilidad de vivienda, la polución del vecindario, son algunos problemas que todavía siguen por la causa de las pólizas racistas del pasado. Y la primera semana de abril, lanzando la semana de Equidad de Salud, es tiempo para poder nombrar los problemas que existen, para de allí tomar acción, para brindar solución sobre esta crisis de salud. Y ella dice que es un gran privilegio estar con los demás que están hablando porque todos están trabajando fuerte y reconocen que la salud es un derecho humano. Y también quisiera nombrar a alguien que habló antes también, reconociendo de que ya a nivel local, a nivel estatal, a nivel nacional, se reconoce que el racismo ha causado una crisis en la salud pública en nuestro país y en nuestro estado. Y es tiempo nombrar este racismo y trabajar contra el racismo en varias pólizas, en instituciones que impactan nuestras vidas. Y ahora podemos ir al próximo. Now we'll listen to our next guest speaker, and I believe this is the one that I had mentioned before. My apologies. We're going to listen to Dr. Linda Berry, Interim Director of the Yukon Health Disparities Institute.
As part of the Bioscience Connecticut initiative to improve healthcare and research outcomes for underrepresented and minority communities. And HCI's mission is to establish Yukon Health as a front runner in promoting health equity by fostering a collaborative environment, so that we encourage various viewpoints to come together, particularly from the community, to answer the question of why. So what is health equity? It means that we're all trying to have the same equitable, good health outcomes, particularly for our residents in Connecticut. But as mentioned, when you want to be a mother as a Black woman, it shouldn't be a death sentence. Your pain should not be mitigated by your skin color. And when I look at policies that have been in place, we've never really acknowledged the structural components that contribute to this. I stand before you not just as a director of an institute. I am a physician. I've been a patient. I've been a caregiver. And in each role, I've seen these inequities. I've experienced them. And so we need to acknowledge that in wanting to gain our path towards health equity, it's not straightforward. When you look at race, ethnicity, socioeconomic status, where you live, where you work, where you play, that they somehow dictate how long you live. And so again, I ask why. As was mentioned, when you look at the numbers, we have to unpack that. And that's where actually research and collaboration helps to create solutions. We need to look at the data and realize it's not as objective as one might think. I mean, race is a social construct, yet somehow it consistently is the same outcome. Mm-hmm. And from the time I was a medical student to now, the same poor outcomes persist. I want to usher in the next generation of health providers and physicians to say we're going to eliminate it. So I look at his health disparities as the current state of play and where we are now. Health equity is the destination. And I and the Yukon Health Disparities Institute look forward to working with you, the community, and our collaborative partners in helping to find that solution. Thank you.
Thank you, Dr. Linda Berry. La doctora Linda Berry del Instituto contra Disparidades de Salud de la Universidad de Connecticut dice de que es muy importante anotar el papel que raza ha tomado en cómo tratan a las personas de nuestra comunidad, que el color de piel no debe de decirle al doctor la cantidad de dolor que uno puede tomar o uno puede sentir antes de que hagan algo, porque lamentablemente en esa situación aumenta la muerte de mamás en el parto, y eso no debe de ser, no debe de tener un impacto tan grande el color de piel, si una mamá va a sobrevivir, dar luz o no. Y ella entra a la conversación diciendo de que la institución de UConn están comprometidos a colaborar con los demás y ser líderes en mejorar la salud de nuestros residentes aquí en Connecticut. Ella, a nivel personal, ha sufrido también, y a nivel profesional, como doctora, ha también podido ver cómo es que el racismo ha impactado negativamente en la salud de nuestras comunidades, y hay que mejorar igualdad de salud aquí en Connecticut, sin depender la raza de uno, etnicidad, a dónde uno trabaja, a dónde uno juega y el nivel económico que uno tiene de ingreso en la casa. Y hay que ver por qué existe todavía esta crisis de salud. Hay que ver cómo la estructura de racismo ha impactado la salud de nuestra comunidad, y hay que influenciar para implementar soluciones utilizando datos. Hay que trabajar en colaboración para poder mejorar la salud de nuestra comunidad. Y con eso vamos a pasar a la próxima persona.
Love to have both of them come up and say a few words.
I was going to say Representative Scanlon, but not outside the cognizance of our patients. We'll fight this fight with each and every one of you in this journey. And if the outcomes don't change, we will be here having more conversations with our partner, our comptroller who gets it, and fight this together. Thank you.
You can see why I am so grateful and so proud to be here with you, Comptroller Scanlon, yes, we want to call you Representative, and Senator Anwar, and all of you, the speakers who spoke, you all have inspired me. I want to just talk about three things: racism, zip code, and action, which are some of the things that you all talked about. Racism is real, and we don't talk about it openly and comfortably enough in the legislature. And I often say that if we as legislators have a difficult time talking about the reality of racism, how do we expect our society and our communities to be able to do that? So that's part of our job, is to not only name that racism is real, but then assess and address. And I want to share just briefly a story about our hearing on the governor's bill on maternal health. We have a really exciting bill that's before us to create birthing centers and to provide universal home visiting and to assure access to doulas, among other things. And in the conversation around the bill, Representative Robin Porter came before the committee and testified. And we talked about the fact that as a mom, I think, Dr. Berry, were you the one who said that it shouldn't be a death sentence? That as a mom going in to give birth, it's such an incredibly vulnerable and challenging, exciting, but very vulnerable time. And childbirth is inherently dangerous. And that you can control for all other factors, but it comes down to the color of your skin that will determine that could determine your outcome. I shouldn't say will, but that could and does. And we see this from the numbers that our comptroller talked about. In the course of the conversation, there were questions that were raised. Well, why does this happen? And one of the questions was, is this genetic? The people on the camera can't see the heads bowing or hear the sighs in the room. We have a lot of work to do to educate, empower, and push for the kind of change and to recognize that this is what we're facing. It's not about malicious intent. Sometimes it is purely helping people to understand what is happening, helping people to understand that this is a reality. And we talked about Serena Williams and the fact that Serena Williams, one of the most powerful Black women in America, talk about having a voice. She can tell the whole story. So because we have such incredible inequality in our state, we have to look at how we plan and zone and develop. And Senator Anwar, you talked about it. Those are planning principles. Where are we building what? And that matters for public health. And then finally, action. We have been given an incredible opportunity. Comptroller Scanlon, has some great pieces in a governor's bill. We have a number of bills in public health, and there are bills in other communities that will allow us to take action, and you're absolutely right. I think, Teresa, you said it, this can't just be lip service. We have to continue to do the work, and we cannot stop. We absolutely have to continue to keep, you have to continue to keep our feet to the fire, and we have to continue to keep our colleagues' feet to the fire so that we can provide choice and opportunity and safety for women of every race, creed, color, background to give birth safely, for people to have access to health care in their communities, for people to be able to be fed well and housed well and safely. And I am inspired to be here by being here with all of you. And I want to thank you for this opportunity, Councilor Scanlon.
En este momento, las últimas palabras del show de hoy fue de la representante Kristen McCarthy Vehey, representando la área de Bridgeport y en Fairfield, y también del senador Salud Anwar, que representa East Hartford, Ellington, East Windsor y South Windsor, y el senador Salud Anwar ha sido un gran campeón para nuestras comunidades a nivel estatal. Y Kristen McCarthy, representante de Fairfield, y ella está nombrando el racismo que existe y no debe de depender la salud de uno en el código postal a donde uno vive, y hay que tomar acción. Y ella está llamando a todos a que tomemos acción, que ahora es el momento para levantar la voz y para poder proveer seguridad, buenas opciones sobre salud para nuestra comunidad. Y en este momento, por ejemplo, madres se están muriendo por tener una tasa de piel de que no es la que los doctores tienen. Y no debe de poder impactar el éxito del parto o tener complicaciones el color de piel. Y los estudios, los datos comprueban que el racismo está presente, impactando si las mujeres viven o se mueren en partos aquí en el estado de Connecticut. Y racismo, lamentablemente, hay 80% de casos de las muertes de mamás han podido ser prevenidos para las mujeres si atacamos el racismo presente. Y esos son datos que se compartió el día de hoy en otra conferencia de prensa auspiciado por líderes de la comunidad. Y vamos a tener más información durante este mes, durante este año, en maneras en la cual se está tratando de cambiar la situación, incluyendo aumentar acceso a parteras de nuestra comunidad, hablando nuestros idiomas y que sean latinas o negras. Y mil gracias a todos por escuchar. Hasta la próxima semana. Thank you all for listening and look forward to joining you once again next week. My name is Caprice and have a beautiful day. Que tengan un lindo día.